Okay, this video is for Hamidi, but I'll leave it up for anyone else who wants to do Pudendal injections. This is the original scan. As we come down, look for our landmarks, and the best way to describe it is if we watch over here, we're going to have a point here, and then at one point it's going to become a nice smooth muscle. So now we have point, nice smooth muscle, obturator internus. Then on the next cut or the cut after that, you will have a straight line, and they have to dive a needle underneath this fascia that you cannot see, that's laying on top of here, like saran wrap. And underneath that, if you look at the anatomy images, is where the pudendal vessels and nerve are running. So in order to do this from the very beginning, first things first, put a mark here. I'll just kind of walk through it. That mark was a little medial. I moved it lateral. Started to come in with the needle. This little anatomic variant is not uncommon, and it makes it difficult to dive underneath this fascia. But nevertheless, this is a bilateral, so we kept coming in from this side at this angle until we got underneath here and injected. The images are kind of mixed up, so you see the injection on this side as well. But this injection is very important because once our needle is underneath the fascia, they're mixed up unfortunately. We see this one, we're making our way underneath here, but we didn't inject from here, right? We went down a little bit farther and a little bit more medial before you see that injection, right about there. If you inject from here and it creates a blob right here, then you're not in that potential space. If you inject right here and it goes inside the muscle, then you're intramuscular, which is also wrong. I used contrast for purposes of demonstration on this exam, but you don't have to use contrast and probably shouldn't for most exams. But now after injection, you can see that this potential space, this line is not here. If I go up before the injection, see where the mouse is, it's not there, but you raise the fascia by putting liquid into that potential space, not into the muscle and not into the ischioanal fat, but rather fill this like a balloon potential space. If you inject and see it in here or see it in here, it's wrong. We also don't inject from up here, right? We take that needle in and then turn the bevel medial and dive it underneath this fascia. You can kind of feel a pop through the fascia, and then you can give a little puff and see if you're underneath there, and if you are, you can inject the rest. The images are mixed up, unfortunately, but you can see the most important part of this is not really the needles, but what the contrast and what the fluid inside is supposed to look like. From right here, I would have thought this is too lateral. It's gonna head into the muscle, so I would have faced my bevel out and let this make its way medial a little bit until I thought it was underneath that fascia. So we don't have to use contrast, but in this case we did, so that people can see what it looks like to fill that potential space, rather than inject back here, which you can do under fluoro, or inject in here, which always looks like a mess. And I've seen these pictures on the internet that look like that, and that's wrong. So hopefully this is helpful, and good luck.